When is a thyroglobulin (TG) level increase concerning? Imagine you're tracking a tiny marker in your blood that can tell you a lot about your thyroid health. That marker is thyroglobulin, a protein made by normal thyroid cells and sometimes by thyroid cancer cells. Doctors often measure it to see how well treatment is working or if cancer might be coming back. But when does an increase in thyroglobulin levels become a cause for concern? Let's explore that. After a person has had their entire thyroid gland removed and received radioactive iodine treatment, their thyroglobulin levels should be very low or even indetectable. This is because the source of thyroglobulin is gone. If levels start to rise after this, it might mean some thyroid tissue or cancer cells are still present or have returned. Usually, a level above 0.1 nanograms per milliliter during suppressive therapy is considered higher than expected. But the real concern kicks in when levels go above 2 nanograms per milliliter. If thyroglobulin levels are between 0.1 and 2.0 nanograms per milliliter, it suggests a low risk of recurrence, but your doctor will want to keep an eye on it. When levels climb from about 2.1 to nearly 10 nanograms per milliliter, the risk of recurrent or metastatic thyroid cancer increases. Levels at or above 10 nanograms per milliliter are especially significant, indicating a greater than 25% chance of the cancer coming back or spreading. It's also important to look at how thyroglobulin levels change over time. A single elevated reading might not be alarming, but if your levels are steadily rising with each test, that could be a sign that cancer cells are growing or spreading. Conversely, stable or decreasing levels are usually reassuring. Another key point is the presence of thyroglobulin antibodies. These antibodies can interfere with the accuracy of thyroglobulin tests, sometimes making levels seem falsely low or indetectable. If you have these antibodies, your doctor will measure them alongside thyroglobulin to get a clearer picture. Rising antibody levels can also be linked to thyroid cancer, so they are an important part of the overall assessment. Ultimately, an increase in thyroglobulin levels, especially if they are rising or exceed certain thresholds, should prompt further investigation. This might include imaging tests like ultrasound or radioactive scans to look for any signs of recurrence or metastasis. It's essential to remember that each person's situation is unique, and your healthcare provider will interpret these results in the context of your overall health and treatment history. In summary, a thyroglobulin level increase becomes concerning when it surpasses 2 nanograms per milliliter during follow-up after thyroid cancer treatment, especially if it continues to rise over time. Levels above 10 nanograms per milliliter are particularly significant. Always discuss your results with your doctor, who can guide you on the next steps and ensure your monitoring plan is tailored to your needs. Remember, regular follow-up and personalized care are key to managing thyroid health effectively.